After receiving a diagnosis of tongue cancer, Ken Vanorny says there are three things that have helped him through his cancer journey.
Prayer, positive attitude, and I work at St. Lawrence Catholic School. So I kept working over there. But I'd see these kids in the hallways and they're smiling and they say, "Good morning, Ken," and give me cards and things every day. So that just boosted me up. That helped so much. It was just amazing.
When Ken started his treatment for cancer, he was identified as someone who would be a good candidate for a clinical trial.
I said, if it will help somebody else, if there's a chance it'll help somebody else, bottom line. It's always been me. If I can help somebody with something, that's what I want to do.
For oral cavity cancer, surgery is almost always the initial option. And so it was never a doubt whether he was going to have surgery. It was just the question of how much and to what extent. And so what the clinical trial asked the question of, is it better to remove all the lymph nodes in the neck? Or maybe we could just identify which lymph nodes drain from the cancer, take those out, and if they're positive, do a neck dissection. If they're negative, spare the patient from a large neck dissection. And that was the trial that he was accepted to.
Dr. Spanos says there is a broad spectrum of clinical trials, and these trials can be beneficial for future research and patients.
The reason we do clinical trials is we don't always have good evidence behind what is the best way to treat the cancer. And we're always trying to move forward to say, is there a better way to do this? And so one route would be to just start giving people things, not track whether it works. Well, we're not going to learn anything from that. Whereas a better way to do it is a rigorous comparison of old way, new way, and to say which one wins.
Plus, Avera has been working to bring more clinical trials to the region, giving patients more access to treatment close to home.
Quite often when people reach diseases such as cancer that are more advanced, they are sometimes having to travel quite a ways. So Chicago, Houston, even the East Coast to gain access to some treatments. And it's very nice that we are able to have some of those newer cutting edge treatments available in Sioux Falls so you can be around your family. You don't have to travel as far.
After surgery, Ken did have to go through radiation for 6 weeks.
When we have those concerning features from the result of the surgery that we think the patient's at higher risk of recurrence, then we apply some radiation treatments afterwards.
It was tough, but his welcome home made it worth it.
On my last day of radiation, they called us on the way home from school to say we're supposed to drive to the school. I have no idea what was going to happen. So we pulled in there, and all of the kids are lined up alongside the road on the sidewalk with cards and banners. Of course, all the teachers, and it was very, very emotional.
Ken continues to meet with Dr. Spanos every few months for follow-up. By participating in a clinical trial, he's potentially offering hope for future patients.
When you enroll in a clinical trial, it's not only for your own benefit. Sometimes you don't benefit. And so clinical trials also are altruistic to help other people out.